Presenting a case of hysteroscopy. This was a 34-year-old lady with previous 2 IVF failures. We posted her for a hysteroscopy pre-ET to look for any pathologies. The ultrasound was absolutely normal. Here, as we can see, we are going in with the vaginoscopy technique, which is the standard hysteroscopy entry in all fertility cases. Here we can see a Nabothian cyst on the anterior wall of the cervix, and now we are trying to negotiate the internal os. We are using a 2.9 mm hysteroscope over here, and here we have negotiated the internal os and entered into the uterine cavity, just waiting for the cavity vision to clear. This hysteroscopy shows features that are suggestive of adenomyosis but are not pathognomonic of adenomyosis. Here we can see the fundus of the uterus, which shows multiple fibrous trabeculae in the fundal area, which is not normal, and this is one of the features suggestive of adenomyosis. Also, as we see further, we can see 2 brown spots over here, which are suggestive of myometrial cysts. These are formed because of islands, ectopic islands of endometrial tissue, and they form into a cyst whenever they secrete. So probably these were subendometrial and small and were not diagnosed on ultrasound. We can see the right ostia over here, but the opening has multiple periosteal adhesions and trabeculae. The left ostium is hardly seen. We can see only the periosteal area. We can also see multiple open sinuses on the endometrium, probably where the endometrial tissue had invaginated into the myometrium. On drawing the scope outwards, we can see multiple open sinuses also on the anterior wall of the uterus. Here we can appreciate in a zoomed in view open sinuses. So these are also suggestive, highly suggestive of endometriosis. At the 11 o'clock position specifically, we can see an island of endometrial tissue. Also, there's an irregular endometrial surface. As we draw the scope out, we can see a small cervical polyp in the endocervical canal, which was of course taken out later with cold scissors. What we did next was an endometrial scratching. As we all know that endometrial scratching is the standard process that we do. And here, when we hit the myometrial cyst, we can see the tarry chocolatey fluid coming out, suggestive of endometrial tissue there. We went ahead with the endometrial scratching, which is known to increase the chances of implantation at the fundus. So the features that were described in this hysteroscopy are highly suggestive of adenomyosis, and this could be one of the reasons for recurrent IVF failures in this lady. We went ahead and completed the endometrial scratching at this point. And that was the final picture. Thank you.